People today in American culture are more often than not taking control of their lives and seeking to change their bodies through plastic surgery. As I talk to people about facial rejuvenation surgery or operations which make us look younger, most patients seem to have certain concerns. It's their eyes, too puffy, or bags, or they look tired when they're not. Or perhaps it is the looseness in their neck, or something I hear frequently is that I'm starting to look like my mother or my father, and I'd like to change that if I could. Well, most of the time we can, and there are multiple operations and procedures and treatments that can address these problems. Some of them are non-surgical, some of them involve surgery. It depends on how involved the patient wants to get. I like to separate facial surgeries into 3 separate zones: the upper face or brow, the mid-face, which usually involves the eyes and cheeks, and the lower face or neckline. Of course, my favorite thing to do is to operate, and so there certainly are surgical procedures. And this requires more commitment by the patient. It means going to the operating room, which means we plan and you come for a preoperative visit, a time when we can get to know your medical history and make sure that what we're planning is safe. It doesn't have to involve a great deal of invasive surgery and extensive anesthesia. Most of the operations we do for the face are done under a local anesthetic combined with intravenous sedation. The operation can be done in a quicker manner and also with less bleeding, and that means less bruising and quicker recovery afterwards. So it's very important in our practice that we have a plan that minimizes the amount of anesthesia and maximizes the speed of recovery after surgery.